Hello everyone. Today we'll have a short note discussion on seizure versus pseudoseizure. Coming to definition, pseudoseizures are defined as paroxysmal alterations in behavior that resemble seizures but are without any organic cause. So there are various terminologies used to define pseudoseizure. Some of them are they are known as PNES, known as psychogenic non-epileptic seizures, non-epileptic attack disorders, non-epileptic conversion seizures, non-epileptic events, hysteroepilepsy, or pseudo-epileptic attacks. Clinical presentation in pseudoseizures is variable. They can present as convulsive type of pseudoseizures or they can present in opistotonic posturing known as arc circle posturing. And some children may present with sudden loss of tone, sudden loss of awareness or unresponsiveness which is sudden in onset which is accompanied by complicated behavior or even myoclonus. So this is an opistotonic posturing which we can see in pseudoseizure. So, what happens in pseudoseizures? So, they generally do not arise from cortical brain matter. So, they do not follow a neurophysiological pattern. And on probing into history, there is often a trigger by emotional or psychological stress. And they generally occur in the presence of others and do not occur during normal sleep. And on starting adequate anti-epileptic medications, also, they are intractable. So, how to differentiate a pseudoseizure from true seizure? Coming to an onset, it is usually gradual in terms of pseudoseizure and it is abrupt in true seizure. And duration, it is longer and variable in pseudoseizure, whereas in true seizure, it is shorter or even longer if it is in status epilepticus. And consciousness is usually preserved in pseudoseizure and they usually respond to pain, whereas in true seizure, it is lost or preserved in certain focal seizures and they are usually unresponsive to pain. Whereas in pseudoseizure, these episodes are followed by crying, sobbing, screaming loudly, or weeping. Whereas in true seizure, it is a monotonous epileptic cry. And coming to movements, they are usually non-synchronous out of phase movements. They may be jerky movements, side to side head movements, or pelvic thrusting, or suddenly the child becomes limp or unresponsive, or the child has an opistotonic prolonged posturing. Whereas in true seizures, there are various kinds of movements which are synchronous, which can be focal or focal to generalized, generalized, motor, and non motor. Generally, it is from small to large amplitude movements. In sleep, pseudoseizures, as I said earlier, they are rare during normal sleep, whereas true seizure can occur in sleep. So, as we already discussed, self-injuries are rarely seen in pseudoseizures, whereas frequent tongue bites, fall injuries, limb injuries are seen in true seizures. Reflexes are found to be normal in pseudoseizures, whereas pupillary construction may be seen after true seizure. There is a little postictal confusion in pseudoseizure, whereas there is a marked confusion in pseudoseizure. And their pseudoseizures are not readily induced by sleep, photic stimuli, sleep deprivation, or hyperventilation, whereas in true seizures, they are often precipitated by these factors. Coming to biochemical parameters, in pseudoseizures, pH is usually normal, whereas in true seizures, we can see hypoxia, respiratory alkalosis, followed by respiratory acidosis due to hypoventilation or apnea. Creatinine kinase is usually increased in case of true seizures and is significant if positive, same as in prolactin, which is increased in true seizures due to activation of hypothalamo-pituitary axis. And EEG foundings are found to be normal during the event in pseudoseizures and they are abnormal. We can see epileptiform discharges in true seizures. Generally, pseudoseizures are provocated by psychiatric interviews, suggestions, or any placebo medications or hypnosis. Whereas in true seizures, hyperventilation, photic stimuli, sleep deprivation may provocate. Thank you.